This segment sponsored by GBMC Healthcare.
Well, cancer is more than a medical diagnosis. It's a life-changing event.
It really is, but with the support and services like those provided at GBMC Healthcare, treatment is about the patient and not just the disease.
Now, here to share more is Erica Cerquetti. Well, welcome.
Thank you so much for having me.
Thank you for being here. So talk to us about integrative medicine. What is it?
So integrative medicine is primarily symptom management, especially the way we do it. It's in the setting of either right when you get a cancer diagnosis, when you're going through treatment for the cancer diagnosis. Sometimes you have side effects from the treatment. And it's also to take care of survivors that have already gone through everything but still have lasting symptoms.
Right.
So it's not just when you're in the middle of it, it's also afterwards.
Yeah, it's like before, during, after.
That's everything.
Yeah.
So how can oncology patients benefit from integrative medicine?
So we usually see oncology patients benefit because we're dealing with the symptoms that aren't completely, it's not like we're micro-focusing on the disease. That's the job of the oncologist. And they do a fantastic job, radiation oncology. And we all work together, but primarily integrative medicine is for managing the symptoms that we don't often think about that come with a cancer diagnosis, such as anxiety, depression, insomnia, nausea, vomiting, just to name a few, as well as sometimes when you get a diagnosis, it stirs up old trauma, so it could be a variety of symptoms.
So that was going to be my question. What are the symptoms that you see most in the integrative clinic?
So right off the bat, I would say anxiety, because it's normal when you get a serious diagnosis, especially before going through a lot of it, you just hear the news. It's normal as a human being to become anxious from that. Depression as well, we see quite a bit of insomnia, which, if you know, can be caused by anxiety and definitely worsened by it. So those are the top three, and pain.
Okay.
Okay, so where do you see patients for integrative medicine services at GBMC?
Sure, so at Current, we have an office in the radiation oncology suite. So that's a 1400 suite at GBMC on campus.
Okay.
Yeah.
So I know that we talked about the patients and all of the things that they feel, but actually coming there, we see some flashing on our screen. How does the clinic help them? What kind of a response are you getting from them?
Sure. So we usually start with a symptom questionnaire.
Okay.
So we know what they're feeling when they walk in the office. And then we kind of zero in during our conversation in our review of systems with each patient to figure out exactly what they need. It is never like one equals the right. It's always a different, very unique plan per patient that involves recommendations for sleep, non-pharmacological ways of managing symptoms. So we're not just talking medication.
Right.
Because that's, everybody could do that, but we're trying to focus on how can we make the rest of life better? How can we help you manage your stress? At Current, we refer to acupuncture, and the hope is soon we're gonna have that in the suite as well, available. We also can refer to our integrative wellness room, which we have volunteers and massage therapy staff working there.
Wow, it's really a whole body experience and a whole soul experience there.
Exactly.
So how do patients get connected with you if they feel like they want to figure out if they are a good fit for you?
Sure. So at Current, we're taking oncology patients that fit under that umbrella. Typically, their oncologist or specialist will refer to our services in integrative medicine, and we also have our office number, of course, that patients can call if they're interested, and we can confirm with their specialist as well.
All right. Well, thank you so much for being here with us today.
Thank you for having me.
The information was there on our screen. It's an awesome program that you were doing. Thank you.
Thank you.
Stay with us.